All right, we're live, we're back. This is Senate Health and Welfare. It's still Groundhog Day, and we are moving on to S98. No, we just did S98. We're moving on to S173. Read the right line. S173, I thought it would be helpful, Jen, for you just to remind us what's in the bill, not going through it in any way. And then to let the committee know that I have talked with folks in the House who are looking at the data privacy bill in House Commerce. And so we're going to try to coordinate. I don't know how that will happen, but they also, this bill that we have is modeled somewhat on Washington State, and their healthcare piece is modeled on Washington State, and it might be useful for us to be doing the healthcare work here. So we'll talk with them and continue that conversation. So that's where we are with that. So Jen, why don't you just share with us a little bit about what's in the bill, and then we'll take some testimony.
Great. Good morning. Jennifer Karby, Office of Legislative Counsel. So this is S173. As the chair said, it's an act relating to the collection, sharing, and selling of consumer health data. I don't know if you want me to put it up, or you just want such a high-level overview that it doesn't need to go up.
If somebody has a specific question, we can go back.
Okay. So you may remember we did a detailed walkthrough a few weeks ago, but this is a bill that requires what are called regulated entities and small businesses that handle consumer health information to have a consumer health data privacy policy that does certain things, prohibits those entities from collecting any consumer health data except with consent from the consumer, or as needed to enable the business to do whatever the service is the consumer has contracted with them to provide. It gives consumers certain rights around the privacy of their healthcare data and sets out some processes if somebody wants to have their data deleted. It also has some restrictions around processors of consumer health data who may be working with these entities. It limits the sale of consumer health data. And then it has, and it prohibits geofences, which you may remember is kind of a construct around an entity that could be used but would be prohibited under the bill from identifying or tracking consumers seeking healthcare services, or collecting data about them, or sending them messages or other communications about their healthcare services. It has the Attorney General's office enforcing the law as a violation of the Consumer Protection Act, and then it has a list of exemptions for other types of protected healthcare information that is protected under state and federal law. How's that for an overview?
That's a great overview.
Great.
And there's, yeah, that was very good. And then there's the consumer health data that's listed. It has some specificity to it. Yeah. Senator Williams.
So are we equipped to be able to do this? Because I know my data has been stolen a couple times at UVM Medical. Stolen, but I don't know if it was sold or not, but so do we have infrastructure in place for IT?
It's a good question. Yeah, I mean, in terms of what the state has for cybersecurity is one thing, but then there's also each hospital or clinic would have some electronic data security. We'll have to ask that question, and then insurance companies will similarly have to share with us that information. It's a good question.
I'm concerned about it.
Yeah, no, you should be concerned about it. And that's what this is about, really.
So, I mean, there could be some money attached to this to actually bring it up to standards, so we could.
I don't know. I don't think that is what we're talking about. I don't think I'm not sure that there is, and Nolan would be the expert on that, a fiscal note on this. I don't see any. Jen,
right. This is really about regulating the interaction between the consumer and the business. So it's about what kinds of protections the businesses have to have in place to protect and to make consumers aware of any health and consumer health information that they may be looking to collect and getting consumer consent first.
About what you would like to have released or not released about yourself. Okay, any other questions for Jen? That was a good question. Anything else? Okay, so let's invite Beth Anderson up. Welcome. Glad you're here.
Thank you for having me.
This is the second time you've been here. So I think this year.
Apologize for taking all of your time.
Oh, no, it's great. The more you're here, the more we learn. It's awesome.
Appreciate that.
Why don't you introduce yourself for the record and then.
Okay, thank you. I am Beth Anderson. I'm the CEO at Vital, which is the health information exchange for the state. Thank you for taking the time to listen today and talk. Vital supports the intent of S-173. We, as you heard from me last week, we take the privacy and security of patient health data very seriously. It's really the foundation of the work we do at the Health Information Exchange for the state. I think if the committee decides to move forward with the bill, I'm here to request that Vital be listed as one of the exemptions that are included in the bill, which would allow us to treat all of the patient data that we collect as to the same levels and standards as the federal requirements. I'm sorry, I do that all the time. We would like to be listed as an exemption in the bill to allow us to treat all of the health data that we have in the HIE in the same way we treat the protected health information. And I'll explain a little bit about what this bill would do differently that would be in conflict with that.
Okay.
I'm also very happy to hear that you're looking at how this aligns with H121, because we do have some concerns about the overlap and confusion, not just for the organizations implementing it, but for patients as well, and understanding how their data is secured and treated. So just as a quick reminder, I know it was just last week, but the HIE, so Vital is an independent local nonprofit organization. We are designated in legislation to operate the Vermont Health Information Exchange, or an HIE. What that really means is we partner with healthcare organizations that treat Vermonters and collect data about patients. We combine that and match it and standardize it across organizations to have a comprehensive health record about patients, and then we make that data available for those healthcare organizations to help improve patient care. So, for example, might be a provider now can know if a patient had a test at another location and see those test results rather than sending someone for a duplicate test. In addition to supporting work at the point of care, the data is used for public health purposes, it's used for care coordination purposes, and it's also used for quality improvement across a lot of organizations at the state. Currently, the data that we receive in the HIE is all protected health information, or PHI. We receive the data directly from covered entities, and it is covered by the kind of privacy and security of all of that data is driven by and aligned with HIPAA, the Health Insurance Portability and Accountability Act requirements, as well as the data use agreements we have in place with each of the organizations that submits the data to us. We also, as you heard, honor patient consent. So in addition to those federal laws, there are local consent or state consent laws that we abide by. So we allow any individual in Vermont to say that they do not want their data shared, and we will not share their health data that we have on the HIE. You heard a little bit last week when I was here with AHS about the plans for the Unified Health Data Space and the way of kind of making the data available in new and more advanced ways for providers to help more with quality improvement and analytics that they need to do. One thing that the state's HIE strategic plan and the Unified Health Data Space contemplate is collecting what we're calling patient-generated data. That might be something like if someone had a wearable heart monitor or has a home blood pressure machine and wanted to input their data into their health record so their provider could see it. And that would be kind of a new use of the HIE for us, but also to allow for an even more comprehensive healthcare record where patients wanted that data available for their providers and other purposes. The challenge would be that because Vital is not a covered entity, we're not a healthcare provider, any data submitted directly to us by individuals would not be treated as, under law, would not be treated as protected health information because the health PHI really applies to covered entities and HIPAA regulated entities. So as written, S 173, would really require us to manage data in different ways. So the data we get from healthcare providers under HIPAA, but the data we receive from patients according to this bill. And we're afraid that that causes kind of overlap and confusion, not just from an operational perspective for Vital, but really more importantly for individuals whose health data is in HIE now, to try to for them to understand that, well, my data that comes from a provider is treated in one way from a privacy and security perspective, but data that I submit might be treated or subject to different rules, and the confusion for us to try to explain that and have them understand that, I think would be significant. And so our preference is really to treat all of the patient data that we have, whether received from providers or patients, as protected health information and subject it to all of those standards of the HIPAA and the data use agreements that we have in place already. And so what we would hope and what I respectfully request is consideration of being exempted from 173, so we can work in that way and really treat all of the data to the higher, more rigorous standards.
Can you, I don't know if you I haven't read your testimony thoroughly. Can you provide us with and identify the section that you're talking about in the bill?
Yes.
And what you would see as important, and so that we can discuss it when we get to that.
Well, I think it's in my testimony, but I will check in if not. There. We'll follow up.
Yeah.
Was that last week?
I think it is in my testimony, but I will check in.
I think it is
and
too.
follow up.
I was looking for the section of the bill, but I don't think that's in there. So specific language, and
Yeah,
Jen is behind you, she's got your back. Okay, go ahead.
Good, so I get your point, it's a good point. Did you recommend language change, any language change?
I can absolutely, my request was to be included in the exemptions that are at the end of the bill. I think it's 1899, but I have to check my memory on that. Yes.
So the issue here isn't that you're buying or selling necessarily, but that you are allowed to share.
Right, and
It's
like,
the sharing piece. So we want to be clear that it's not, you're not packaging it up and selling it off to some company in Timbuktu.
no, it's restricted in our agreements. It's restricted in the Strategic Health Information Plan, the state's plan that's approved by the Green Mountain Care Board. The data is not meant for commercial, like selling purposes. It is for patient care, public health, the same purposes.
Senator Hurry, question.
I guess I would like to hear from others if they support this exemption and whether it should be a narrow exemption from part, because
We need to understand
I
what
want-
the, no,
yeah,
we're just not
Yeah,
suggesting that we agree with the recommendation. I'm suggesting we need to look at it in the context of the bill. So-
yeah, no, I understand that, because and it concerns me that there's already, and Jen, maybe this is a question for you. Is it in statute that Vital can't share information, or is it just in their agreements? I mean, because they're not a state entity, they're a nonprofit organization. I want to make sure that there are statutory
They are in
protections.
So I
There's-
need to look specifically at the statute, but they are, I mean, as Beth mentioned, they are named in the statute as the exclusive operator of the state's health information exchange. So
Exactly. No, I understand that, but I want to make sure that there are also protections in statute that prevent them from, not just in agreements, but in statute.
So can I?
Go ahead.
Okay.
Yeah, if you could answer the question, and then this is obviously an area that we'll have to have Ledge Council weigh in on
Yes.
with us when we get to it, but go ahead.
So part of how the data, so we are subject to HIPAA for the health data. We do have the data use agreements in place, but another piece of information that does guide is designated, or in statute, is a requirement for the state to deliver an HIE strategic plan each year that needs to be approved by the Green Mountain Care Board. And in that is sorry, I never remember if it's an appendix or an attachment A, which outlines further restrictions or around access to data on the HIE, and that is a place that this could be, if and when we do collect patient data, that it would be included in that. So that is part of our work with the state and Agency of Human Services.
Yeah, I understand. Like I said, I understand that it's in the agreements. I think it might need to be in the statutes as well.
We'll have to look at what when we went through the development of Vital, and I remember putting a whole lot of privacy and security, and it was a huge conversation. So, Jen, maybe you can, when we get to this in the markup or the going through the bill again, you'll help us understand what is there and what protections are in place for patients.
Yes, and there is language in the statute, so it's all one big statute about the Health Information Technology Plan. It's the one that designates vital, I believe, and has a lot of things about what has to be in it, including privacy standards and protocols that must be no less stringent than applicable federal and state guidelines, including HIPAA and other provisions. So there is a lot in the statute directing the development of the plan that relates to privacy, confidentiality, and security. And so that then informs what can be in the agreements with Vital.
Okay.
We'll get to it. It's a good question. Is there anything else you want to say about that, Beth?
No, thank you very much.
No, thank you. Thanks for being available. And as we go through the bill, it will be very helpful to keep you in touch, have you here at different times, because when we go through particularly the section where you think Vital belongs, then we need your input. Okay, and you've heard the questions about security and so on. Thank you.
Thank you very much.
And then Jessica Barquist is here. Thank you for being here, and you did reach out to testify on this.
Thank
Glad
you.
did.
Yeah, happy to be here. Hello, Jessica Barquist. I am the new VP of Public Affairs for Planned Parenthood and really happy to be here. As you all are probably very well aware, Planned Parenthood of Northern New England provides comprehensive reproductive and sexual health care to more than 16,000 people in Vermont at our 7 health centers, and virtually through our telehealth program. People turn to us for high quality, affordable care, including wellness exams, birth control, STI testing and treatment, as well as a variety of other limited primary care services. And we see everyone who comes to us, regardless of their ability to pay, and also provide approximately $800,000 in free and discounted care to our communities every year. So as a mission-driven healthcare provider, we fundamentally believe everyone should be able to access affordable, high-quality sexual and reproductive healthcare in their communities, no matter where they live, how much they make, and we advocate for policies that make that vision a reality. All people deserve access to comprehensive reproductive health care, including abortion and gender-affirming care, free from shame, stigma, and intimidation. Stigma, fear of prosecution, and harassment from anti-abortion and anti-LGBTQIA groups are significant barriers to accessing the health care that folks need, and therefore providing privacy protections is a really crucial step to safeguarding healthcare access. So here in states like Vermont, where abortion is protected and as well as gender affirming care, we're going to play an even more critical role in providing care to people from states that criminalize that care and jeopardize that access to healthcare services. The fall of Roe has had devastating and far-reaching impacts that land disproportionately on people who have always faced systemic barriers to care, including communities of color, the LGBTQIA community, undocumented immigrants, young people, those living in rural communities, people with disabilities, and people with low incomes. These individuals and all of us need to be able to access essential health care without fearing for our safety and our privacy. And protections for all of our healthcare and health-related information is an increasingly important component of that access. Private health information, including consumer data related to reproductive health, must be private. Ensuring privacy protections for and control over the collection and use of our own health data is even more important as the breadth of that information collected and inferred from our personal data grows. No one should fear that their personal data will be compromised or used against them, and people seeking care in our state should not be subject to targeted ads about their private healthcare decisions or have their location tracked and shared via geo-targeting when seeking healthcare. Sadly, this information is already being weaponized to surveil and prosecute pregnant people, including those seeking abortions, and Black communities and people with low incomes are being disproportionately targeted. So as you mentioned, S-173 is based off of a law enacted in Washington that was fully supported by the affiliate there. And I want to give a little bit of background on why this bill is really needed and is separately and distinctly needed from what is currently in H-121, the other data privacy bill. So currently, people have very little insight or even less control over how their information is collected, used, shared, and sold. Despite the widespread use and disclosure of personal data, just 6% of adults report that they have a strong understanding of what companies do with the data they collect, and nearly 68% are somewhat or very concerned about their online privacy. While the federal HIPAA law provides protections for our data collected by healthcare entities, a growing number of personal health and health-related information is held by non-healthcare providers and collected through website and app data, among others, but is not protected by HIPAA. So as a result, a growing amount of personal healthcare data is left vulnerable to collection and disclosure without the consumer's knowledge or consent, including by anti-abortion groups in investigations and prosecutions, or for targeted advertising. Period tracking apps collect sensitive information about a person's menstrual cycle and fertility, including information about a late period or miscarriage. This sensitive information can then be disclosed and sold by companies and data brokers. Pregnant individuals sometimes contact or visit a crisis pregnancy center, also known as an anti-abortion center, looking for reproductive health care services, only to find that they cannot receive an abortion at that facility. But while they're there, the crisis pregnancy center collects and shares that person's sensitive data with anti-abortion groups, who can then target that person with anti-abortion messaging and political ads. Digital advertising firms can set up geofencing around healthcare facilities that activate when a person brings their cell phone or mobile device across that barrier. Geofences are a virtual perimeter drawn on a map around a physical location. Apps, websites, and devices can be programmed to send advertisements and/or messages to individuals when they enter that specific location. This is a tactic frequently used by digital advertisers and can bombard users with text messages and advertisements urging them not to seek reproductive or gender-affirming care. And these are not just hypothetical concerns that I bring to you, but real tactics that are being used to target pregnant people in this country. And I added some examples for you, and I'm not going to go through all of them, but I'll just share that in 2016, geolocation data was used to identify visitors to 140 abortion clinics in order to send those individuals ads for anti-abortion counseling. In 2022, a local data broker sold aggregate location data of people who visited abortion clinics, including more than 600 Planned Parenthoods over a 1-week period, for just $160. And in 2021, Flow Health, which is one of the most popular period tracking apps, settled with the FTC over allegations that it shared health information on 100 million of its users with third-party data analytics. So S-173 protects access to healthcare and reduces barriers to access by preventing these apps and websites, like our health tracking apps, the search engines, advertisers, and other entities from selling, collecting, or sharing people's health data without their express consent. It requires entities that collect people's data to maintain and publish a privacy policy for that data. It establishes consumer rights. It prohibits those geofences I mentioned from being used at healthcare facilities. And it empowers the Attorney General to enforce the bill under the State Consumer Protection Act. Planned Parenthood supports policies that protect individuals' right to privacy and control over their personal health-related information. As states across the country ban access to abortion and gender-affirming care, Vermont is playing an even bigger role as a safe harbor for patients and their loved ones throughout the country. Improving privacy protections for personal health data is essential in safeguarding healthcare access. There was one in section 1 recommendation that we have, and I have it in my written testimony, the language, but just a little bit of a clarification in section 1896. we would recommend, just to align that with the other sections, to really establish that the consumer rights include the right to confirm whether that entity is collecting, sharing, or selling their data, and that right to consent to that collection and sharing. So I have that written out. And that's really all I have to share with you. I want to thank you all so much for your efforts to protect Vermonters' privacy and better ensure that no one in our state fears harassment, investigation, or prosecution for seeking, providing, or assisting another in accessing essential health care.
Thank you, thanks a lot, and I'm hoping you're gonna give your testimony digitally, yeah,
Yeah.
that's great. I do have a question. I understand that, you know, Planned Parenthood's clinics treat men and women. And I recently read an article about the increased incidence of syphilis in the country, one of the severe sexually transmitted diseases. So this would protect that information from a male or a female patient being co-opted.
That's absolutely right. It would protect all of our patients from having their information sold.
But it is significant to reproductive health care, in particular for women, because they have been targeted across the country, and I appreciate you bringing that to our attention. Great. Senator Weeks.
As a male, I get it. I get it without having the reference
Yeah,
to the syphilis. So, I get it. So my question to you is, it seems that the bill is targeted more towards health information that's exchanged between hospitals and pharmacies and providers and that kind of thing. And my sense, and that's why I'm looking to be corrected, is that it's not reaching into apps that people may use on their phone, which might track menstrual cycles and that type of thing.
That's a geofence.
I was just you said you're happy to be corrected. I'll correct you.
That's exactly.
It does actually
Okay,
does.
good.
relate to the apps too, and saying those companies of those apps can't share the data as
Okay,
well.
very good. So
Yeah.
so what is it in the bill besides support for aspects of the bill? Are there elements of the bill that you're objecting to? Okay, because I couldn't draw out of everything you said, except for, kind of advertising for.
No, we fully support this bill, and the Planned Parenthood Federation of America considers this model legislation for protecting consumer health data. And I will just mention the hospitals and pharmacies, their health data is protected under HIPAA. And so this bill really deals with non-HIPAA entities that are holding healthcare data. And so that's really where we're looking at those apps and those websites and wherever else, right? Like I'm wearing my Garmin right now, which is tracking my personal health data, right? So it's things like that that we're really looking at adding those additional protections to.
Okay, thanks.
Well, thank you for your testimony. This was something that Chair and I talked about last session as a concern, so I'm glad that we're taking it up this session. Given the last testimony that we heard, does Planned Parenthood have concerns about exempting Vital?
Not off the top of my head. I don't have any concerns with that, but would love to kind of take that back to my team and just make sure that feels good. Because
there are already protections for them about HIPAA, but as you said, and as we've discussed, this is way beyond HIPAA data. So I just want to make sure we're not.
Yeah, I don't have any concerns, and recognize the importance in Vital being able to have their data follow a single set of requirements, but we just want to make sure that there is that prohibition against selling and that information feels really protected for folks too.
Yeah, okay, thanks.
And happy to work with Beth on that.
Yeah,
for sure.
Yeah, no, so this is great, good. I think we'll probably follow up further with this bill in particular, so it seems like it's an important one. All right, so thank you for being here. We're good for today, and I think we're going to go off live, and I just have a couple process things to talk about with the committee for next week, and then we'll